ABC News medical contributor and Stanford Children's Health physician, Dr. Lok Patel, joins me live now for more on this. Dr. Patel, thanks for being here. According to the CDC, infections are up 22% from last week nationwide. Should we expect some ebbs and flows in these numbers from now on, or is this a cause for concern? How do you decide between the two?
It's hard to, Diane, but I think we should expect these ebbs and flows, especially because this is likely undercounted based on how many home tests are being done. I think the big litmus or pressure test is coming this summer, as in some parts of the country, people are going to be outside, which is great for ventilation. In other parts, people are going indoors. As we have a more contagious variant raging in the Northeast, and we're seeing these grim numbers in Puerto Rico, we're gonna have to look to see what really happens. But I think this is just proof to people out there that as we continue to try to live a normal life with COVID, you can almost expect to run into the virus. So make sure you have that baseline level of protection.
And Dr. Patel, hospitalizations are up, but the number of COVID-related deaths are still dropping. What do you make of that?
What I make of that, Diane, is that we have the ability to care for people in the hospital setting, but we should not disregard the fact that when we have hospitals full or hospitals getting full, especially in rural areas with people who have COVID-19, we have exposures, we have the inability to treat other patients, and there's a lot of indirect effects of these hospitalizations. So yes, the direct number of deaths is going down, which is a great thing, but this still has long-term public health implications if we continue to see roughly 20,000 people hospitalized from COVID-19 on a given day.
Now, the White House has been asking Congress for $22.5 billion in emergency aid to continue responding to the pandemic. What more do you think the government can do at this point?
The government has to continue lobbying and just talk about what the impact really looks like in terms of preparing us for the next outbreak, the next pandemic. The recent model came out showing that if we don't have any new layered protection in place, no new congressional funding, another 100 million infections could take place by fall. That's a lot more hospitalizations, a lot more exposures. And this is a bad precedent given that we have 30 million underinsured or uninsured Americans. What does that say in terms of our ability to care for one another? We've been relying on free access to testing, vaccines, monoclonal antibodies, funding for research and treatment. What happens when that all goes away? This is the picture that needs to be painted for lawmakers.
So I think you just listed it there, but can you just explain what you mean when you say layer of protection or layers of protection?
When I'm talking about layered protection, I'm talking about if we do not go back to mask mandates, we stop prioritizing ventilation, and we stop going back to all these mitigation measures that have helped us throughout the years. This doesn't mean that we want to go backwards or that we want to have lockdowns, but as we see a rise in cases, those communities, especially vulnerable ones, need to know that we're looking out for them. They're the ones who don't have the ability to miss days of work if they're sick, or say, hey, we're going to isolate at home. We're going to take time away to not expose ourselves. They don't have those choices. What do we do to protect our most vulnerable?
And we're now hearing some new reports about long COVID in children. So what should parents look out for?
It's very difficult, but parents should honestly look out for those insidious signs in kids from long COVID, such as brain fog, fatigue, trouble breathing, chest tightness that may not be explained by another cause. And it's not easy for parents to try to decipher this. So chat with a healthcare provider about these insidious symptoms. We're seeing case reports all over the place from 5, 10, maybe more % of these kids who are testing positive. I shouldn't say testing positive, but are being diagnosed with long COVID. And unfortunately, right now, there's not a lot we know. We don't really know the cause. And the treatment is individualized. So parents, just be on the lookout. Do everything you can to get your kids vaccinated and protected.
And I'm out of time, but I just quickly want to ask you, is it possible to see a kid get better and then suddenly start exhibiting these symptoms?
It is possible, and remember, we see long COVID in kids who can have asymptomatic or mild initial infection, and their long-term trajectory, it kind of depends on the individual, but fortunately, there are more long COVID clinics popping up day by day and more physicians talking about it.
All right, Dr. Patel, great to have you. Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.